If this is your first time with us, welcome. If you're a returning viewer, welcome back. And thank you for taking time out of your Thursday morning to be present for today's session on mental health. My name is Alex Elswick. I'm an assistant extension professor for substance use, and I'm joined today by a couple of my colleagues, Kerri Ashurst, who's a senior extension specialist in FCS Extension, and Mindy McCulley, who's our extension specialist for instructional support. She'll be behind the scenes doing everything techie to make today possible. This is our 6th session in a 7-part series, and we hope that these sessions are helping you think about the ways in which you can play your hand if you're living with loss and feeling grief. The final session will take place at 11 a.m. Eastern Standard Time on May 27th, and the focus of that session will be self-care and outdoor physical activity, so very sort of timely as we move into the summer months. Before I introduce our speakers for today's session, I'd like to review just a couple of housekeeping rules. First of all, if you would keep your microphones on mute to minimize the traffic, that would be helpful. Secondly, you can type your questions into the chat box, and the speakers will all take time to address them. We've checked with all of them. They're all happy to be interrupted by questions as well if you've got some on your mind. So you're welcome to throw those out there in the chat box. And then if you prefer, you can wait until the end and ask a question by unmuting your mic. Today's a really important topic. We're talking about mental health. We know that individuals, families, and communities have faced intense mental health challenges related to the pandemic, including increased substance use and elevated suicidal ideation. To help us face, better understand, and respond to the mental health challenges and the crisis, we have a few presenters today who are sort of our content experts. So I'm going to start with some introductions. Our first speaker is Holly Bender. Holly is a licensed clinical social worker and certified in advanced palliative hospice social work. She currently works as a bereavement counselor at Bluegrass Care Navigators in Lexington, where she provides individual, group, and family grief care. She also works with school counselors and psychologists across the state to help them better support grieving students. Following Holly, we'll be hearing from Kristen Martin. Kristen is an early childhood mental health program administrator at the Department for Public Health, where she supervises specialists and programs related to healing, empowerment, and recovery. In private practice, she works with grief and substance use disorders, and she has experience working as a bereavement counselor. And I'm going to hand it off to Kerri Ashurst to introduce her colleague, Julie Cerel.
Yes, good morning, everyone, and thank you for joining us. Dr. Julie Cerel is a dear friend of mine. She is a licensed clinical psychologist and professor in the College of Social Work here at the University of Kentucky, and she is the director of the Suicide Prevention and Exposure Lab at UK, and currently serves as the interim associate dean for research in the College of Social Work. Her research is focused on suicide exposure and bereavement, suicide attempt survivors, and suicide prevention. And she recently completed a term as past president of the American Association of Suicidology and is co-author of Seeking Hope, Stories of the Suicide Bereaved. Thank you for joining us, Dr. Cerel.
And Holly, you can take it away.
Okay, thank you. Hi, I'm Holly Bender, and for my part today, I'm going to cover basic topics of grief for adults. So whether you're a griever yourself or supporting a grieving person or a combination, I think that you'll find some useful information here. Grief is a normal and natural reaction to the death and loss experience, but there are many types of loss that don't include the death of a person that can be very painful and relevant, such as jobs, relationships, incarceration, divorce, or illness. There are also secondary losses that occur due to a loss. For example, if someone dies, you may have to move to a new home or have a reduction in finances. Children may need to move schools or change neighborhoods, and nobody can determine what constitutes a loss for another human being, but today we're going to talk about grief as the death of a person. So in this case, we're going to define grief as all the emotions that come along when someone dies. It's important to keep in mind that grief is a process, not an event. You don't get over it as many people and our culture today may encourage you to do. You're always going to love that person, and so you're always going to grieve that person. However, the initial pain does soften, and over time, grief evolves and is integrated into your life, and well-being is restored. Everyone's unique in this experience, and their timeline for the process is also unique. And so it's just really important to let people grieve in their own way and at their own pace. And in this next slide, aspects of grief. Grief is normal, but it doesn't feel normal when you're experiencing it. In fact, nothing at all feels normal about it because it touches every aspect of our lives, emotionally, physically, behaviorally, cognitively, socially, and spiritually. It's exhausting. Grief impacts people in all of these areas, but it's also a unique experience for each person. And this is because people and their relationships are unique. So, for example, there are differences in people that have limited coping strategies or less support of their friends or family or coworkers, and than in people who have a strong support system and many healthy coping strategies that they effectively utilize. It's also important to consider who was the person that died and what was the relationship to the griever. For example, did they lose a child, a spouse, a parent, a friend, a coworker? What was the relationship like? What type of death was it? Was it natural, accidental, suicide, overdose, a long illness? Were there previous losses, and how were those losses grieved? There are also many differences in personality styles and also many social and cultural variables to consider as well. So no wonder grief is different for each person. On this next slide, we're going to talk about some common reactions. These are just a few examples of a very long list of reactions a griever may be experiencing. Emotionally, it's really common to feel numb, angry, anxious, relief, guilt, uncertainty, fear. Behaviorally, you may feel more irritable or restless or less motivated. Cognitively, it's common to try to wrap our heads around the reality. We may feel it is unjust and unfair. Maybe you blame yourself or someone else, or feelings that it could have been prevented. And it's often really difficult to focus and concentrate. Spiritually, as human beings, we try to understand the how and why of the bad things that happen and try to make sense of things. Sometimes we ask, why did God let this happen? Or why did this happen to me? And religion may play a role in this for some and not for others, and that's okay. What matters is that we're trying to make sense of this hardship, and that each of us will make sense of grief and loss differently. Physically, grief is exhausting. As I've said already, it's common to feel like you're in a fog. People often have difficulty with appetite, with sleep. Socially, you may be withdrawn from people or usual activities. You may feel you want to be alone one minute and you want to be with others the next. And this can be really confusing. But just know that it makes sense for feelings to change suddenly or to feel more than one way at a time. Keep in mind that anything you may have been struggling with before will likely be magnified, such as anxiety, depression, concentration. And lots of times, people feel like they're going crazy when they're experiencing the symptoms of grief. And it can be reassuring to know that they are common reactions and that they will shift and change through the grieving process. I already mentioned that grief is unique for everyone. This also means that everyone grieves differently. So it is common that even though everyone in the same family lost the same person, they may grieve in different ways. This is because differences in personalities, age, gender, relationship with the deceased, and many other factors. So if family members are grieving differently, it's important to know that this is normal and there's just really not a right way or a wrong way to grieve. So to clarify some examples of this might be, everybody expresses their emotions in different ways. Some people cry and some people just aren't criers. And some people are really verbal and want to talk about their feelings. Well, others just aren't as verbal and they may need to find different outlets to express themselves, like writing or art or music. And what might comfort one griever may not comfort another griever. For example, some might find comfort from going to the gravesite or wearing the person's clothes or jewelry, while others may not. And sometimes not understanding this can cause friction among family members as they feel others aren't grieving correctly. And so it's just important to be aware of these differences and to remind yourself that everyone's grief is different and that is okay. And on this next slide, we're going to define some types of grief. Differences between the difference between grief and mourning can sometimes be confusing. So let's just go ahead and define that. I think of grief as the inward process, such as what we think and feel on the inside when someone we love dies. For example, feelings of fear, yearning, anxiety, emptiness. And mourning is more the outward expression of grief, like crying. Anticipatory grief is a time of grief before the loss occurs. It can be a response to the loss of function, such as eyesight, the loss of identity, such as a job, changes in a role, like in your family or work, in addition to impending loss or impending death. In the case of impending death, anticipatory grief can start as soon as you become aware that death is likely, such as the diagnosis of a terminal illness. And anticipatory grief is experienced not only by the terminally ill person, but also by the family, friends, caregivers, anybody that loves and cares for this person. And it can be beneficial in ways because it can help prepare you by developing coping skills to help you with the inevitable changes to come. Ambiguous loss is grieving someone who is still alive. Maybe there is no verification of death or no certainty that the person will come back or return to the way they used to be. Some examples are family members who are incarcerated or serving in the military, giving a child up for adoption, or a child who's in the foster care system, changes in personality due to addiction, mental illness, or dementia. Cumulative loss may occur when an individual experiences multiple losses, either all at once or before processing an earlier loss. So when you have experienced multiple losses within a short time period, you may begin to wonder how much more loss can you endure, and experiencing multiple losses can be really painful and overwhelming. For some people, grief does not integrate into their life over time, as I mentioned previously. Feelings of loss may remain debilitating, and this is known as complicated grief, also called prolonged grief disorder. And in this form of grief, painful emotions are so long-lasting and severe that people have trouble recovering from the loss and resuming life. Disenfranchised grief refers to any grief that goes unacknowledged or unvalidated by social norms. This kind of grief is often minimized or not understood by others, which makes it particularly hard to process and work through. I'm going to go ahead and turn it over to Kristen now, who's going to elaborate more on disenfranchised grief and cover death due to overdose.
Hello, everybody. I'm Kristen. You'll have to bear with me. I've caught a cold, and so my voice is in and out, but I'll do my best to stick with this today. So I'm going to take a closer look into disenfranchised grief. So this phrase that you're seeing on the slide was coined by Ken Doka, and it refers to grief that is experienced when a loss cannot be openly acknowledged, socially sanctioned, or publicly mourned. So the grief is not recognized or isn't acceptable to others, as Holly previously mentioned. Some examples of this are substance use disorder, perinatal loss, suicide, past lovers, dementia, hospice workers, older adults, and pets. There's a stigma associated with drug addiction and opiate use, which can contribute to this disenfranchisement. Thankfully, more bereaved are coming forward and talking about their loved one's cause of death, but sadly, many still do not. This may be because people fear that they may be judged or criticized, or think that there's even something more that they could have done to prevent this death. So let's look at the complexities of grief reactions when there has been an overdose death. The stigma society imposes on substance use is overwhelming. It's one of the biggest issues. Sometimes the stigma is self-imposed, and it's important to explore this because some people may feel judgment from others regarding themselves, their family, and their deceased loved one. Unfortunately, people deeply misunderstand addiction. There is a stigma related to this type of death. Sometimes people avoid telling others to avoid all the questions they may get. They sense judgment from others or implications that they just didn't do enough. People feel the need to defend the image of their loved one and sense people staying away because they just don't know what to say, which also leads to a strong sense of isolation. There can be shame. This is the emotional counterpart to stigma. Stigma is connected with experiencing oneself as inferior or powerless, often involving a sense of exposure. Shame about the addiction, for not doing enough to help, or for enabling the person. Sensing blame from others who feel that their loved one caused their own death and are somehow less worthy of being mourned. Some feel judged or ashamed for loving someone with an addiction or for having an addiction themselves. Unfortunately, shame makes people hesitant to share their experience. Consequently, they don't reach out, but rather become isolated and lonely. It's really a sad downward spiral at times. There can also be blame for others who didn't help or for not preventing the death, or even self-blame. Also blame for those who used with the person. Family members may even blame themselves. Most of the time they blame the person less than they blame themselves or others. The bereaved may understand substance use disorder is a disease and the person couldn't control this, which may lead them to blaming others more. If they're unable to understand that substance use is a disease, then it is important to first educate the grieving person so that they can understand that the deceased person couldn't control this addiction. Relief is often felt because the worry and chaos have ended. The feeling of relief is then sometimes followed by feelings of guilt. In addition to this, there may be pharmaceutical blame, which is anger at the person who gave or sold the drugs, anger or blame at the medical community and rehabilitation community, maybe the sober living environment, or anyone who played any kind of role like this. Blaming themselves for not seeing it, blaming the deceased person for using, which can also be tied up in anger. Bereaved parents may blame themselves and other people in their lives who didn't help, people who could have been instrumental in making a difference in the addicted person's life but weren't, blaming the medical community or other family members for how this person was treated due to their addiction issues. Years ago, medical providers were highly encouraged to prescribe medications for pain. This has only recently changed. There are many things that occur when a bereaved person is grieving a loved one's overdose death. Some of these are: their sense of self can change after such a profound loss. The bereaved person's view of themselves can change, especially because of the stigma they experience. Confusion related to the nature of addiction. So, for example, it's not uncommon for someone to go back to rehab 9 or 10 times, but others with no experience view this as very uncommon. Plus, people who still think of addiction as a choice and don't get the addictive component to it. Next, there's isolation, even within family systems. Family members may be protecting others from knowing the full extent of what's going on and not wanting to burden others. So this person may feel very alone. At work, they may not want to share this personal information with others due to the stigma they're afraid of. Also, there may be nothing available to help families understand their grief when their loved one is in the midst of their addiction. They grieve the loss of the family member they once knew when that person is still alive. Another complexity are feelings of grief. People often relive over and over again the should-haves, could-haves, and if-onlys. They blame themselves and others. Many focus on the negative rather than the positive. It's not surprising that they're burdened with guilt. They may spend a great deal of time and emotional energy wishing they had done things differently. They may judge themselves for not doing more, saying more, or being able to stop an unexpected death such as this. The truth is they have probably done more good than harm in the life of their loved one. Guilt is often deeply embedded in the grief process. When there is guilt, the person feeling guilty believes that they have caused the harm. It's important to explore this with the person to determine what they really did or what they think that they did. It's important to validate their guilt, determine if it's real or perceived, educate them about the addiction, work towards self-compassion and self-forgiveness, and then explore the difference between that guilt and regret. The bereaved person may feel very conflicted. There may be resentment and anger about addiction, relief or guilt. It may be hard to remember the good times, or they still may need to remember the person rather than the death itself. So finally, let's focus on anger. There can be lots and lots of anger revolving around this type of loss. I've heard many, many things from bereaved people related to anger. So some examples of this are, they might be angry because of their tough love approach. Maybe there was conflict between parents and other family members, feeling hopeless or helpless in the situation, at the number of years that this consumed their family's life, what was stolen from the family, like maybe it's literally or figuratively, and because of missed clues along the way. So now let's look at some helpful ways to cope with grief. People often ask me, how do I know if I'm grieving correctly? Am I avoiding my grief? Am I too immersed in my grief? One thing I hope you take away from today is there is no right way to grieve. That is up to each individual griever. However, it is very important to find balance. Spend time paying attention to your grief, but also take breaks from it. Going back and forth at your own pace or in a way that feels right to you will help grief feel more manageable. This slide gives you some examples of ideas and ways to pay attention to your grief. It's important that you find the best way for you to express your grief, keeping in mind that this is just a list of examples or a starting point. Regardless if you're a grieving person, if you're supporting a grieving person, or especially if you're both, it's very, very important that you take care of yourself. Sometimes people feel that taking care of themselves is selfish, so they neglect to do what is helpful for themselves. However, it's so important that you understand that taking care of yourself is critical, not only for your own mental wellness, but also so that you can take care of others. It's important to identify what taking care of yourself looks like for you, as this is different for each individual, and then claim your right to practice self-care regularly. This may seem like a simple idea, but it's not simple to actually do. We're forced to be more creative during a pandemic to find ways to grieve because we don't have the same access to our support system or our normal coping mechanisms. Some examples of this may be practice self-compassion, allow more breaks, lower your expectation of yourself, and remember that you're not at your best right now. Allow yourself to cry and express emotions freely. Do things that comfort you, such as visiting the gravesite or looking at pictures, if these are helpful to you. Have healthy coping skills in place that you can use, such as writing, exercising, listening to music, meditating, yoga, or talking to a healthy support person. Educate yourself on grief and dispel misconceptions. Have healthy supports in your life that you can reach out to often. So now let's talk about how we can help others help you. We previously mentioned reaching out to others for support. This is mentioned frequently because it is so important. It's easier said than done when you are a grieving person. People often feel that they're a burden to others or that they are usually the helper, not the one that needs help. So this can feel awkward. Maybe they feel like they should be doing better, or they just don't have the energy to make the effort. But connection with others is key to grievers. What they find instead is people begin to fade away after the first several weeks or months, often when the grief is starting to feel harder and more real. It's not usually the case that friends or family that were once there don't care, but rather they just don't know how to help or may be uncomfortable with the grief. They don't know what to do or say, and so they do or say nothing. If you have friends and relatives who are acting awkward around you now, they may be having problems not knowing how to respond to your grief. It's likely they would love to offer you some type of support or comfort, but they just don't know how. Try giving them a role to play that will help you in your grief process. So, for example, many people are glad to know the following ways that they can help. Ask people to call you. Let them know not to expect you to call them when you need to talk. You may not have the energy to call, even if you need to talk to someone. Offer specific dates or times of the day that they can do things for you. Ask them to think of your down times or times that might be more difficult for you. Maybe these are the evenings or weekends in particular. Let them know to feel free to talk to you about the deceased person. They don't need to avoid saying the person's name or asking how you're feeling about the death. You may seem to be doing well on the outside, but a lot is going on the inside. Some people mistake your lack of composure, lack of tears in the moment, or your ability to complete a task at work and other signs of doing well for being over it. Let them know that you're doing better in some ways, but you still have bad times along with the good times, and you still have a lot of grief to work through. Let them know that they can treat you like a real person. You may be grieving, but you're not a China doll. You're not going to break. You may be slower in your thinking and lack your usual sharp concentration and focus, but you're not someone without brains. You just might need a little bit more time and patience. Most of us feel awkward around pain and suffering. That too is normal. If you're fortunate enough to share moments of pain with your relatives and friends, you will eventually share moments of joy with them as you emerge from your grief. So this next slide looks at self-care essentials. There are 4 essentials that I like to keep in mind when thinking about caring for yourself. The first one I have listed here is physical activity. So this refers to physical self-care and physical health. Physical self-care involves activities that improve your physical health, such as diet and exercise. It's important to stay active in a way that's fun and rewarding for you so that you'll continue to practice this regularly. This could be going for a walk, hiking, playing a sport you enjoy, or taking a yoga class. Remember to find the balance. While it's important to stay active, make sure you rest when your body needs it. Rest is the second essential component to self-care. We live in such a fast-paced world that sometimes we forget that it's okay to take moments to pause and rest. Listen to your body and see a doctor if you're sick, instead of just trying to push through. The third essential is nutrition. Nutrition can refer to something as simple as just eating more fruits and vegetables to fuel your body, as well as staying hydrated. You may want to try out new and exciting recipes that are healthy. This is one way to keep nutrition fun. Next, we have social connection listed. Social connection is a very important part of self-care. Schedule regular times to meet with friends, to take a walk, maybe schedule a weekly phone call with family members or friends, or try out the new recipe you looked up together. Social connection has been extremely hard on people during the pandemic. However, there are safe ways to feel connected to others during these times. It's helpful to physically see someone when you're wanting to connect to them. You might want to try to use FaceTime more, or Zoom, or Google Meets, so that you can stay connected in a more personal way. So focusing on your emotions when practicing self-care is extremely important. Emotional self-care involves taking care of yourself and your emotional health in order to obtain emotional well-being. This can be taking time to meditate, write in your journal, practice gratitude by personally reflecting, or sharing these with others, and talking to a close friend, seeing a therapist, or leaving positive notes for yourself. By scheduling time in your day, each day, to focus on your mental health, you can reduce your stress and improve your overall happiness. Caring for your mental health looks different for everyone. There's no right or wrong way to practice self-care as long as it's helpful and healthy for you and makes you feel relaxed. So now we'll look at how to support a grieving person. People are usually concerned about what to say or do for a grieving person. So sometimes they just don't say or do anything. It's important to acknowledge the death. Your presence in reaching out means that you care. Check in and let them know that you're thinking of them. If they want to talk, they'll respond to your call or text. If they don't, they still know that you care. Finding correct words is not always necessary. There is nothing that you can do or say to take the pain away. Often your presence and willingness to listen is more powerful. Sometimes grieving people need to share the same story or memory over and over again. Grievers often tell me that they stop doing this because they feel like a burden to friends or family. Allow them to share as many times as they need without reminding them that you've already heard the story or memory. Grievers like to talk about their person, hear their name, and hear and share pleasant memories. So it's okay to bring this up. Your presence is the most valuable thing you can give. Sit near your grieving friend or family member. Hold their hand, give a hug, pass a tissue, cry with them, and listen to them. Don't struggle with finding the right words to say. A simple "I'm sorry" is enough. Directly ask your friend or family member what they might need. Talk if they want to talk, keep silent if they prefer silence. Focus on giving more than receiving. Grieving people need much help and rarely have much to give in return. Try to be specific in the ways that you can help. Instead of saying, let me know what I can do to help you, say something like, I'm on the way to the grocery store. What can I pick up for you? Or I'd like to bring a meal over this week. What night works best for you? Give the person permission to feel whatever feelings their grief brings them and resist the urge to fix or offer a silver lining solution for their pain. Grief is long lasting. Keep invitations coming unless they ask you to stop. Invitations go a long way, even if they choose not to follow through. Continue to check in on the person. Avoid cliches. When someone we love suffers a loss, we often feel at a loss for words. When we feel at a loss for words, we may grab for something that we've heard before, often something we've heard again and again. How many times, for example, have we heard "time will heal" said to a grieving person? The problem with reaching for these old cliches is that they often do not provide comfort, and in fact, they even offend grieving people. Our society feels so uncomfortable with pain and grief that many times we give and get the message that we should get back to normal quickly. Of course, even when we heal, we probably won't ever get back to that normal, if normal means being exactly the way we were before our loss and our grief. Remember these people on special days. So sending a note on the date of the death or on the person's birthday, leaving a sweet treat on the person's desk at work, or dropping it off by their house to let them know that you're thinking of them. Also, you could do something as simple as sending a private Facebook message or text message to the grieving person, just saying, "thinking of you today." Those are all great ways to offer that support. Now I'm going to turn this over to Julie, and she's going to talk more about suicide loss.
So I think the essential of suicide loss is really understanding that suicide bereavement is very similar to bereavement from other kinds of sudden traumatic death, but it's also different for people. Similarly to the same way that substance abuse grief has people feeling stigmatized, feeling anger, suicide grief has a lot of that. There's shame because the cause of death, people don't feel comfortable talking about it. But I think the fundamental difference of suicide death compared to other kinds of death is the why. People who are suicide loss survivors spend years with that question of why and if only and what could I have done. So people who are bereaved by suicide really get stuck sometimes in trying to figure out why that night, why that day. They seem to be doing better. They seem to have figured it all out. And so similarly to other stigmatized causes of death, like substance abuse or overdose, it's important to do all the things that Kristen and Holly had talked about. Reach out to people. Don't be afraid to say the name of the person that died by suicide, just like you would if they died in a car accident or died from some other source. Because people who have experienced the suicide of someone they care about, often that person gets erased and people really don't feel like they can talk about them or talk about their life without talking about those very last horrible, painful minutes of their life that ended in their death by suicide. I think also on top of this, it's important for us to really talk about how bereavement is what we've been talking about for the most part today, but there's a larger portion of people that are exposed to deaths. So and I always talk about the difference between bereavement and exposure. And so when someone dies by suicide, yes, there's a small group of family members who are intimately affected by that loss, but there's at least 100 other people that really know that person and might have been impacted by their death. That could be their sports team or their school or their community of faith. And so when you're thinking about the effects of deaths like suicide on people, don't just think about the families, think about who else could be impacted. Because we know that people who are significantly impacted by the suicide of somebody that they feel close to are themselves at risk for their own suicides. So I know we'd had a couple of questions. Did you want to cut in at this point and have some of that dialogue, or should we finish up with our slides?
If anybody has anything that they would like to go ahead and maybe post, questions, thoughts, or something they would like to share, please feel free to go ahead and do that. Absolutely, Julie. And, share that both in comments or even also as follow-up with the presenters today. But yeah, I think maybe if you want to go ahead, and then we can go ahead, and now that we've offered for people to start posting any comments or questions, let them start doing that and typing that as well. And just like that, we do already have one, actually.
Yeah, I saw that as I was asking.
Hearing you reminded me of several persons that have not lost anyone, but had COVID-19, and they lost several things that they used to have, like smell, taste, energy, etc., and are going through losses that they used to have and now feel more tired, angry, blame others. Do you think they're going through grief?
I think, as Holly talked about in the beginning, grief is really a change in how life used to be and really kind of mourning what life is now. And so it's not grief in the traditional sense of having experienced the death of someone we care about, but those transitions really are places that people struggle and can use help if they're continuing to struggle. One of the things that we have in our resource page is who we lost KY. So this question was about people who have had COVID-19, but a lot of Kentuckians have died from COVID, and it's become a stigmatized cause of death. I've heard from a lot of people that when they tell others about their loved ones' cause of death from COVID, they get a lot of reactions like, well, didn't they follow the guidelines? Didn't they wear a mask? Why'd they go places? And there's actually been secret Facebook groups, for example, of people who are COVID mourners who can relate to each other without getting all of those social media comments. And so I think it's important when we think about all these kinds of grief to really think about the impact we're having on people who have these major life losses and how our reaction can really make a big difference for people.
And I just posted the web link that Julie mentioned in the chat, whowelostkentucky.org.
Well, and if I could just add really quickly too, to that question, And in the practice that I work in, I've worked with several people that have had COVID, and I would say they're definitely grieving the loss of what they knew before and what they now know after the illness. And so I think we take for granted things like being able to enjoy food and going out to restaurants and doing all the things that we used to be able to do that look differently now. And I think that that's been a huge struggle, and a big secondary loss for people is the side effects from the illness afterwards, for sure.
And I think we've all had our transitions in the last year, and there are different things that people grieve about the before the pandemic. And so that, coupled with these kinds of losses, either traumatic or not traumatic, make things much more difficult for people, and are the kinds of things that people need in trying to figure out if they need to seek help. And so this slide really talks about our collective wisdom on what it is that what clues people might have, either in yourselves or in people you're working with. When is it that they need someone besides their peers or their friends, their peers or their family? Because a lot of the times people are told with grief, oh, it's just grief, you'll get over it, everybody grieves. There's a lot of misinformation that grief goes in very systematic process, the stages of grief that people used to talk about. And that's definitely not the case, that people can have waves of grief, and grief can kind of come and go. Anniversaries can be really hard on people. So even when it's been a decade since a loss, when it's an anniversary, or when it's, oh, this is when he would have graduated from high school. Even if the loss was 18 years ago, that can be a huge time that somebody is struggling. And so it's important to realize, like Holly had talked about, grief doesn't end just on a certain date. You're better, you go back to your life. So if your patience level has changed, or the person you care about, their patience level, if they feel numb or isolated, if they have that preoccupation with the loved one or with the death, they just can't get past it. Every day they're yearning for the person they lost and the life that they lost, and they just can't get back to their normal daily activities months later. That's what we would refer to as prolonged grief, and we would want to get that person some help, especially if they're feeling worthless or hopeless or having thoughts of their own suicide. A lot of the time, people who are grieving will go there. We talk about preoccupation with death as a symptom that we worry about with people, but of course, people that are grieving are preoccupied with death. The details of death, what's happening, what happened before it, it's only when we get really concerned is that they're talking in ways where they say, I just want to join him, or I just can't go another day without him here. Those are the thoughts of suicide that get us really concerned. These are some resources that are available in Kentucky and nationally. Bluegrass Care Navigators, their grief care services number. National Suicide Prevention Lifeline is 1-800-273-8255. I think one thing that people don't realize is that Lifeline and crisis text line 741-741, those are both available for people who are not themselves suicidal, but are really concerned about someone they care about. So if someone's talking to you and they're just not able to get past their grief, and you want to figure out what are some resources or what are some things you can say for them, those resources are exactly for you. Don't feel like you're wasting someone's time by calling or texting those numbers. And then that website, Who We Lost KY, just came out a few weeks ago, and just is a lovely resource of people's stories. Anyone can submit a story of someone who died from COVID. And really show how we lost so many people across the state and share those stories.
One thing that Dr. Cerel and I have done too along the way with some trainings we have done is encourage people to put this number that she has on the screen here and this text line into your phones. Have those handy, because you never know when that moment might come, when you're working with someone or talking with a friend or, someone in your daily life, and have the opportunity to be able to provide that number to someone to help them, or call that phone number with them even. And I also have often encouraged people to call that National Suicide Prevention Lifeline. And when they answer, just tell them, I'm walking through this. I'm not suicidal, but I want to walk through this just to learn the process. I think it's good to learn about the processes that unfold when you call that number. See how long the wait times can be, because sometimes if you're working with someone who's suicidal, that can be really important for them to know. You're going to be put on hold for 5 minutes while they connect you to someone that's as local as they can get you to, knowing that that's right, knowing that that's something that just might happen and that that's the norm rather than, it's just you personally. And so, walking through that process and kind of learning what it's like and experiencing it yourself too in your work that you might be doing to help others along the way.
I would like to add too, as far as grief support goes, the number we have up here is our local number that's affiliated with our hospice. Sometimes we've changed our name, but we're also Hospice of the Bluegrass. So what some people are really surprised to hear is we don't just work with hospice people. We work with people in the community and can provide free support for them as well. So regardless of the death or if they had a family member in hospice when they died. So we do work with sudden loss. And I know there's many people here in different counties. So other hospices do that as well. So it would be really beneficial for you to contact the hospice in your area. We cover 32 counties. And so some of you are within our service area, but for those of you outside of our service area, there are lots of other hospices that provide the same service. They have individual, family, group. They might offer grief camps for kids. All kinds of services. And so please contact your hospice in your local area and see what that is, because it is usually a free resource for anybody who's experienced loss.
Do we have any questions, comments, requests for more information or resources from anyone?
A resource that I think is really great, the talking, and now I can't get it. The talking
facts.
Talking facts.
I'll put that link in the chat. Actually, that's a great idea, Julie.
Which has been put together. Do you want to talk about it, Kerri?
Yes, please. Please talk about that.
Yes, basically, our unit that Alex and I are in, and Mindy is Family and Consumer Sciences Extension at the University of Kentucky. And Talking Facts is basically, it's Talking Family and Consumer Science, FACS. And it's a podcast series that we've been doing for some time now. Mindy, you might need to just chime in and say how long, because I'm not sure how long we've been doing it. But the podcasts are very short, usually 10 to 15 minutes long, and cover a variety of different topics and just really provide a great resource. And in fact, we just posted one at the start of this week that Dr. Cerel did, kind of in anticipation of this webinar today, that's on the topic of suicide exposure and bereavement. So it is actually available now. I will post that link on here for you.
So we actually have 189 shows that are available on the Talking Facts podcast link, and we are in our 3rd season. We're about to wrap up our 3rd season. So we've been busy beavers and putting together lots and lots of resources that are available for people all over across the state of Kentucky. And you can find it on wherever you get your podcasts. It's on all major podcast providers, and just look for Talking Facts. And I will pop up a screenshot of the graphic that you can look for here in a minute.
And it's hosted through something called Podbean, which, Mindy, correct me if I'm wrong, I believe you can go to just as a web link, but you can also download an app for Podbean to be able to listen to those on a phone or on the go.
That is correct. Yeah, or you can get it on Apple Podcasts or on Google Play. Any, like I said, any provider has the resources of it. Excuse me. Yeah, so we have podcast 189. As I said, this was our 189th show that we posted this week.
Congratulations.
For people who are grieving, the idea of a podcast or the book that Kerri talked about in my introduction, Seeking Hope, they're very short. And someone who's grieving oftentimes doesn't have the energy or the focus to be able to sit and read an entire book or to listen to an hour lecture on something. And so the podcast and the book, we have very short chapters, each from a different person who lost someone to suicide, but then came out at a place of hope, are designed to be very short and to give people information quickly in a way that they can digest and get help.
And I am actually posting, just for sake of finding it quickly, the Amazon link to that book that Julie co-authored for you as well, if you would be interested in looking into that. And yeah, in addition to the podcast that we just did on suicide exposure and bereavement, there are podcasts that have gone along, I think, Mindy, with each and every one of these
Yes.
Living with Loss
Yes,
weeks. Okay, so we are currently in week 6 right now. And so there is one final week, 7th and final week next week in our Living with Loss series that we hope you can join us for as well, that is on the topic of self-care and outdoor physical activity. And I know that Kristen mentioned the importance of just getting any kind of activity in when you're coping with grief and loss, that it can really be a tremendous way to move your body, relax your mind. Sometimes can be a wonderful way to get your mind off of things that you might be preoccupied with as well. And so, I think that's kind of come up as a theme in things that everybody has talked about today. So that will be our 7th and final piece of this Living with Loss series next week. And again, as we're winding up today, we want to make sure that each of you know that we would love to continue to have conversation and follow up with you. Requests for resources or information, and that the contact info for each of the presenters is there on your screen now. And we encourage you to do that and let us know if there are things that we can get you information on along the way to help you in your positions and roles.